Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Samir. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Tell me more. I'm really sorry to hear about that, Mr. Samir, and I understand that how stressful situation would be for you. But before I come to the management part, I would like to ask you a few questions to better understand your condition. How it sounds to you, Mr. Samir? Thanks for your cooperation, Mr. Samir. So, can you tell me since how long you are suffering from this condition? Mm-hmm. Okay. Mm-hmm. Um, have you had any previous kidney disease? Any stones? If you had any injury? Mm-hmm. Okay, and have you noticed a decrease in urine output? Okay. Mm-hmm. And have you noticed any difficulty urinating? If it is painful? Mm-hmm. Okay, Mr. Samir, if you have noticed any foaming of urine, any blood in urine? Mm-hmm. Okay, changes in urine output? Mm-hmm. Color of your urine? Okay, all right, Mr. Samir. If it is associated with fever? Mm-hmm. Okay, if there is any pain along with that? Mm-hmm. Okay, and how about your appetite, Mr. Samir? Mm-hmm. Have you noticed any nausea, vomiting? Mm-hmm. What kind of a diet typically you have? Mm-hmm. All right, Mr. Samir, can you tell me if you are engaged in strenuous exercise? Mm-hmm. Okay, have you noticed any joint pain? Mm-hmm. Feeling fatigue? Mm-hmm. Have you noticed you become short of breath? Mm-hmm. And you swelling in your legs? A visual problem? Headache? All right, Mr. Samir, I'll ask you personal questions to better understand. Is it okay with you? Thanks for your cooperation, Mr. Samir. So, if you are suffering from any medical condition like diabetes, mm-hmm. Okay, high blood pressure, if you had any heart problem in past, mm-hmm. Any stroke, mm-hmm. Right, Mr. Samir, do you smoke? How many cigarettes per day? Have you ever tried to quit this habit? I really appreciate that, Mr. Samir, and we'll talk in detail in next appointment. How it sounds to you, Mr. Samir? Mm-hmm. Okay, Mr. Samir, how about you sleep? Mm-hmm. What do you do for living? How's everything at workplace? Mm-hmm. If you're married, do you have children? Mm-hmm. How's everything at home? All right, Mr. Samir, if you're taking any medicine prescribed by doctor or over the counter, mm-hmm. So if any medicine requiring dose adjustment, mm-hmm. Okay, have you noticed any rash? Have you noticed that your skin has become darker? Mm-hmm. Any weight loss? Mm-hmm. Back pain? Mm-hmm. All right, Mr. Samir. To better understand, I need to examine you. How it sounds to you, Mr. Samir? Thanks for your cooperation, Mr. Samir. Can you please come on the couch? I'll sanitize my hands and let them dry. So first I'll start from general physical examination. So I'll look at patient overall, and then I'll to check if how's his look, if it is toxic or not, and his color. And then I'll start from BP, pulse rate, respiratory rate, and then I'll check his palms if there is any palmar erythema, any moist, and check his skin texture. And then I'll check his nails if there is any changes in nails, any hemorrhages, any horizontal dark lines, and any colonchia, clubbing, spoon shaped nails, and any notes on hands. And then I'll check his pulse, and then I'll check his neck, and I'll ask patient to lie down. Mr. Sami, can you please lie down on the couch, and I'll elevate your head side at 45 degrees. Thanks for your cooperation, Mr. Sami, and please keep your shirt till your nipples. Okay, so then I'll check a carotid brie, and then I'll auscultate on abdomen to check abdominal brie, and then I'll auscultate heart, aortic, pulmonary, tricuspid, and mitral area, and then I'll look and feel. I'll start examination of abdomen. If there is any scar mark, any deformity, any bulging, any distension of abdomen, and then I'll feel. I'll feel gently, and then I'll check for organomegaly, and then I'll check kidneys bimanually from each side, and check if there is any bruise that's at lumbar region, and then I'll do fluid thrill for if there is any ascites, and then I'll check shins for edema, and for muscle wasting. Thanks for your cooperation, Mr. Sami. You can come on the couch, and at the end of examination, I'll sanitize my hands again. Mr. Sami, I'll order a few investigation. Hard sounds to you, Mr. Sami. But before I order, let me confirm if you have undergone an investigation so far. All right, Mr. Sami. Then I'll order a few tests, ultrasound, KUB, okay, and complete blood count, and urea, creatine, electrolytes with EGFR, okay, and protein AG ratio, okay. How it sounds to you, Mr. Sami? Okay, Mr. Sami. So now let's talk about the non-pharmacological management. Okay, so I'll encourage you to adopt some lifestyle modification, okay, and lifestyle changes. And so, Mr. Samir, I'll encourage you to lose some weight, okay, and try to balance your diet with low sodium and low potassium, okay, and protein restriction 0.8 to 1 gram per kg per day, okay, and monitor fluid intake and output, okay, and monitor your BP at home, okay. And besides that, I'm offering follow-up appointment, okay, when your reports are ready, okay, ultrasound and blood test, okay, you can visit anytime then, okay. And then we'll decide, maybe you need to refer to a specialist, okay, if your labs will be deranged, okay. And then and decide about influenza vaccine, okay, annually a pneumococcal vaccine for once in a life, okay. and then we'll adjust your medicine. Okay, how it sounds to you, Mr. Samir? Is everything clear till now? Should I repeat it again for you? Thanks for your cooperation, Mr. Samir. Here's a leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. Mm-hmm. Yes, Mr. Samir. Then we'll be managing underlying costs. Okay. Accordingly, you need not to be worried. Okay. I'm here to cooperate with you. Okay. Take good care of yourself. Bye bye.